Okay, so should I try therapy? That's something a lot of us think about, right?
Yeah, for sure.
And we're going to deep dive into that today with a couple of interesting sources. One's from Access Health and Community, very practical.
Okay.
And then another one, this one's from Poland. It's called Therapy, Investment in Development and Prevention of Mental Health.
Okay.
And this one kind of reframes how we think about therapy as a whole.
Yeah, it really does.
Where, sure.
I think this Polish piece, one of the big things it does is it challenges that idea that therapy is just for crisis situations when
Mhm.
everything's going really bad. Um, it really makes this argument that therapy can be like this proactive investment in your own, personal growth and mental well-being.
So it's almost like you're going to the gym for your mind. You're not waiting till you're totally out of shape.
Yeah, exactly. It's preventative.
Okay, interesting. But what about someone who's like, maybe I should try therapy? What would be some signs that they might actually benefit from it?
Well, the Access Health and Community source, they give a few concrete signs. One they talk about is experiencing intense emotions more frequently.
Oh, like,
Like, think about feeling constantly on edge, or maybe you're more easily frustrated, or sadness that feels kind of out of proportion to what's going on around you.
yeah.
Like.
So it's not just I'm feeling sad. It's more about how often and how strong that feeling is.
Yeah.
Hmm.
And actually, the Polish article, it links back to this idea of therapy as personal development and suggests that actually therapy can help you develop skills in emotional regulation so you're not always just, at the whim of your
So you
feelings.
can kind of have that pause between feeling and reaction.
Yeah, exactly.
Okay, interesting. So what about those feelings, but then they lead to some kind of unhealthy habits?
Well, that's another sign that Access Health and Community point out.
Okay.
Things like turning to drugs or alcohol or food or even sex to try and cope with negative feelings.
Oh, wow.
It becomes a way to kind of numb out or distract from what's really going on.
So you're not actually enjoying it anymore. It's more like you're using it to escape.
Exactly.
Yeah.
It's like a crutch.
Yeah.
It's a way to avoid dealing with whatever is underneath.
Okay. What about if you're a person who tends to overthink? Is there a point where just thinking a lot becomes a sign that therapy might be helpful?
Oh, yeah, absolutely. The Access Health article, it flags recurring negative thoughts as a potential indicator. So this goes beyond just having a bad day. It's like consistently having these negative thoughts about yourself or others or different situations.
And that sounds hard to get out of. But wouldn't therapy just be adding even more thinking?
Right, and that's where these different approaches come in. The Polish article mentions a variety of therapeutic methods, including cognitive behavioral therapy.
SPBT. Yeah, I've heard of that. What is that exactly?
Yeah, CBT. It's a type of therapy that focuses on identifying and changing those negative thought patterns and behaviors. So it's less about, dredging up the past and more about developing these practical coping skills.
So you're getting tools to help you kind of manage those thoughts instead of just stewing in them.
Exactly.
Yeah.
And, it's been shown to be quite effective for like anxiety and depression, which, by the way, that's another sign that Access Health and Community mentions is when those emotions start interfering with your everyday life.
Yeah, so it's more than just feeling down. It's like it's affecting your work, your relationships, just your ability to function.
Right. It can be things like you're having trouble concentrating at work, or maybe you withdraw from social activities, or you even experience like outbursts of anger.
Yeah.
These are all signs that maybe those emotions are starting to take over rather than you having control.
Yeah, and it's a good point to bring up that if any listener is experiencing thoughts of self-harm or suicide, you need to seek immediate help.
Right. Absolutely.
There are resources available. Like if you're in Australia, there's Lifeline at 13 11 14
Yeah.
and the Suicide Callback Service, 1-300-659-467.
Mm-hmm.
And if you're not in Australia, remember there are similar helplines worldwide.
Yeah.
Sites like Head to Help and Headspace are also great resources. But, getting back to those disruptions to life, it's almost like your inner world is spilling out into your outer world.
Yeah, exactly. And that's where therapy can be so valuable. It can really help you to understand those internal processes, develop those healthier coping mechanisms, and ultimately regain that sense of control over your life.
It's not about getting rid of emotions. It's more about navigating them better.
That's a great way to put it.
Yeah.
It's about building that resilience so you can get through those rough times without being totally pulled under.
I like that. Okay, there's one last sign from Access Health and Community that I think a lot of people can relate to. Loss and grief. Losing a job, a relationship, a loved one, those are major life events that can really trigger intense emotions.
And sometimes those emotions are so big, it's hard to deal with them on our own. Grief, especially, that can be a really complex and long process.
So how do you know when it crosses that line from just normal grieving to needing professional support?
That's a tough question, and there's really no easy answer, but
Yeah.
the Polish article suggests that therapy can be really helpful for just navigating any kind of big life transition, even if it's not necessarily a negative one.
So it's not just about fixing something that's broken. It's also about navigating change and growth.
Exactly.
That's a really interesting way to look at it. So it seems like we've really just scratched the surface of what therapy can offer.
Yeah, we have. But, I think these signs are a good place to start if you're thinking about whether therapy is something that you know might be right for you.
Okay, so we've talked about some signs that therapy might be worth considering, but what about the actual benefits? What can someone realistically expect to gain from this process? We'll delve into that after a quick break. Stay with us.
Okay.
Welcome back. So before the break, we were talking about some of those signs that therapy might be worth considering. But what about the actual benefits? Like, what can you realistically expect to gain from going to therapy?
Yeah, I think, beyond just addressing specific problems, the Access Health and Community piece frames therapy as a way to learn new coping strategies, like in general.
So it's not just about fixing what's wrong. It's more like you're getting equipped with tools for the future.
Yeah, precisely. And actually, the Polish article, it gets into a few of those tools specifically. Like, one example is mindfulness exercise.
Mindfulness. Oh, yeah. That's another one of those buzzwords you hear all the time. What exactly does that mean, like in a therapy setting?
Yeah, so it involves learning techniques to kind of be present in the moment, without judging yourself.
Okay.
And this can be really helpful for managing things like anxiety or reducing stress or just improving your emotional regulation overall.
So it's about being able to kind of observe those thoughts and feelings without getting swept away by them.
Yes, exactly. And it goes back to what we were saying before about those intense emotions, right? Therapy can help you to create that space between the stimulus and your reaction and give you more control over how you actually respond to those challenging situations.
Okay, that makes sense. So it's not about like getting rid of the emotions altogether. It's more about managing them better. What other benefits does Access Health and Community talk about?
They talk about achieving a greater sense of clarity and peace of mind.
Is that just a fancy way of saying you'll feel better?
Well, it's more than just feeling better. I think it's about developing that deeper understanding of yourself, your thoughts, your behaviors.
Yeah.
And therapy gives you that safe space to explore those things, with somebody who's objective and non-judgmental.
I imagine that would be really valuable, especially if you're used to feeling judged or misunderstood.
Exactly. And actually, the Polish article touches on that as well. It mentions how therapy can help individuals to kind of challenge those negative self-perceptions that they might have formed, maybe through some difficult past experiences.
Oh, so it's not just about coping with the present. It's also about kind of unpacking how the past might be influencing your present thoughts and behaviors.
Right? It's about gain that self-awareness, understanding where those patterns come from, and then developing those healthier ways of relating to yourself and to others.
That's pretty powerful stuff. It seems like therapy goes beyond just addressing those surface level issues. So what about like the impact on physical health? Does Access Health and Community say anything about that?
They do. They actually highlight that link between our mental health and our physical health. They point out that research shows a strong correlation between, poor mental health and chronic physical conditions.
So taking care of your mental health isn't just about being happy. It's actually important for your overall well-being.
Absolutely. Like, for example, chronic stress and anxiety are known to contribute to all kinds of physical problems like heart disease, digestive issues, even skin conditions.
Wow, I didn't realize the connection was that strong. So therapy could be seen as a preventative measure for both mental and physical health.
Yeah, that's a great way to think about it. By addressing those mental health concerns early on, you're potentially reducing your risk for developing those physical problems down the road.
It's like investing in your whole health portfolio, both mental and physical.
Exactly. And the Polish article kind of echoes that sentiment. They emphasize that taking care of your mental health is a form of self-care, just like, eating well and exercising.
Okay, so we've talked about coping strategies, clarity of mind, the impact on physical health. What else does therapy have to offer?
Well, Access Health and Community also points out the positive effects that therapy can have on relationships.
Yeah, I can see how that makes sense. Like if you're struggling with your own emotions all the time, it's going to be hard to be there for other people.
Right. Therapy can help you to develop better communication skills, to set healthier boundaries, and to build those stronger, more fulfilling relationships with the people in your life.
And the Polish article adds an interesting layer to this. It suggests that therapy can also help you to understand your own relationship patterns. So like recognizing those recurring themes or those dynamics that keep popping up in your relationship.
Exactly. It's about, being able to spot those patterns and then working to break free from those negative cycles that might be holding you back.
And that seems especially relevant, given that one of the signs they mentioned earlier was actually using relationships as a kind of unhealthy coping mechanism, like specifically sex.
Yeah, that's a really good point. By addressing those underlying emotional issues, therapy can help you to develop those healthier ways of connecting with other people, both physically and emotionally.
It sounds like therapy really is a holistic approach to well-being. It's not just impacting your inner world, but also your external relationships.
It really is. And then finally, we come back to something that we touched upon earlier, the fact that therapy, especially when it's combined with medication, is often more effective than medication alone for treating things like anxiety and depression.
So it's not about choosing one or the other. It's about finding that right combination for your individual needs.
Exactly. The Polish article stresses that, medication can be helpful for managing symptoms in the short term, but therapy gives you those tools and strategies for long-term healing and growth.
So the medication might help you feel better temporarily, but therapy actually gives you the skills to stay better over time.
Yeah, that's a great way to put it. It's about empowering you to take control of your mental health and to create those lasting positive changes in your life.
Okay, so we've covered a lot. From those signs, you might benefit from therapy to understanding the potential benefits.
Mm-hmm.
But for a lot of people, I think that first step of actually like picking up the phone and calling a therapist,
Yeah.
it can feel really daunting.
It's totally understandable. It can feel kind of hesitant or unsure. It is a really personal journey and it requires a lot of vulnerability.
Yeah,
But I think it's good to remember that therapists are trained professionals.
right?
They've dedicated their careers to helping people work through these very challenges.
So it's not like going to a friend or family member for advice. You're going to someone who's actually equipped with the knowledge and the experience to give you guidance in like a safe and supportive environment.
Exactly. They've created that space specifically for you to be able to, explore those thoughts and feelings without feeling judged. And the Access Health and Community article really highlights how important it is to find a therapist that you feel comfortable with, someone that you trust and can connect with.
I guess it's kind of like any other relationship. You need to have that sense of rapport and understanding.
Yeah.
But how do you actually go about finding the right therapist? It seems like such a personal and subjective thing.
It is, and the Polish article actually has a really interesting analogy.
Okay.
They compare finding a therapist to finding a good hairdresser.
Oh, wow. Okay, I wasn't expecting that. So how does that work?
Well, just like with a hairdresser, you want someone who gets you, who listens to what you're looking for and ultimately makes you feel good about yourself. And sometimes you got to try out a few different people before you find the perfect fit.
So it's okay to kind of shop around a bit until you find a therapist who just feels right?
Absolutely. You shouldn't settle for someone who's just okay. You deserve to have a therapist that you feel comfortable opening up to, someone who you feel can help you to achieve those goals. And actually, the Access Health and Community article gives some advice on how to actually go about finding a therapist.
Okay.
They suggest you start by contacting their intake team for a confidential discussion.
And if you're not in Australia, there are similar organizations and helplines all over the world. You can also ask your doctor for a referral, or you can search online for therapists in your area.
Mm-hmm.
But I think the most important thing is to just take that first step, even if it feels a little scary. Reaching out for support is a sign of strength, not weakness. It shows that you're taking your mental well-being seriously.
I agree.
So is therapy the right path for you? Well, only you can answer that question. But hopefully this deep dive is giving you some things to think about and some insights to help you make that decision for yourself.
And remember, therapy is just one tool in the mental health toolkit. There are so many other things that you can do to support your well-being, like practicing mindfulness, getting regular exercise, connecting with nature, nurturing your relationships.
It's really about finding what works for you and creating a personalized approach to mental health that really nourishes your mind, body, and spirit. And if therapy seems like a good fit, just remember there are resources available to guide you through that process. You don't have to do it alone.
Exactly. And just remember, you deserve to thrive.
Thanks for joining us on this deep dive into the world of therapy. We hope you found it informative and empowering. Until next time, take care of yourself.